On Sunday, the 10th of April, 48 million French citizens will be heading to the polls to elect their next president. To mark the occasion, we're embarking on a journey across France in this rather beautiful electric car to explore voters' key concerns. A journey that's going to take us from here in Paris all the way to the French Caribbean. This is France 2022, the road trip. We begin our road trip here in Strasbourg, the capital of France's Grand Est region.
With my kids, Martin and Clémence, medical things like going to the doctors, that's a big part of our lives.
We looked after COVID patients, but also other patients. But you can't come out of a crisis like that unscathed.
In the early months of the pandemic, this region was among the first to see an explosion of COVID cases and also suffered one of the country's worst death tolls. A closer look now at a healthcare system that's been pushed to breaking point over the past 2 years.
In 2020, France's total healthcare bill came in at just over 209 billion euros, covering everything from hospitals and medicine to local healthcare and ambulances. That's the equivalent of 3,109 euros per resident, or 9% of France's GDP. Last year, there were 387,000 hospital beds across the country, or about 6 beds for every 1,000 people. That's significantly more than in the UK, where that figure drops to 2 beds, but less than in Germany, where there are 8 beds for every 1,000 residents. And the number of beds in France has actually been steadily decreasing in recent years. Today, French public health facilities can accommodate 25% fewer patients than they could in the year 2000. In the wake of the COVID-19 pandemic, the government promised to invest 19 billion euros in hospitals and care homes over the next 10 years, a sum which includes a salary hike of 183 euros net per month for the 1.5 million French nurses who found themselves on the front lines of the crisis.
After more than 2 years of COVID, health ranks among the 4 most important election issues for French voters.
Health is an extremely important issue for me. With my kids, Martin and Clémence, medical things like going to the doctors, that's a big part of our lives. My mum also fell ill last year and my brother works in an emergency ward. So I feel very invested in state-run hospitals. And it's something I'll be considering very carefully in this election.
Our health system was the envy of the world, and it crumbled. During the pandemic, we saw almost everywhere that we weren't prepared for what was coming our way.
There needs to be enough money to have a functioning health system. Hospitals that work effectively with well-paid employees. Because healthcare is vital for people, but also for the country.
The vast majority of COVID patients in the Grand Est region were treated in public hospitals, the same hospitals that, even before the crisis, were complaining they were understaffed and underfunded. We're meeting Professor Emmanuel Andrès, President of the Strasbourg University Hospitals Medical Council. Hello, Professor Andrès.
Bonjour, madame.
Hello.
At the start of the COVID-19 pandemic in France, Strasbourg was really at the heart of things. Just how badly was the city hit and also the wider region?
The pandemic hit us here first in February 2020, and we did have a small stroke of luck, if I can say that, as Italy was hit before us, and also the French city of Mulhouse in the Haut-Rhin department. So we did have a little bit of time to prepare, and after that we were faced with this sea of COVID patients we weren't expecting.
And how exactly did you deal with the avalanche of patients you were receiving, patients ill with a disease that at the time we knew very little about?
Yes, it was a completely new illness and we had very little data. We did have some information from China and also Italy, which was hit ahead of us. So all of a sudden decided to dedicate almost 90% of all the hospital's resources to our COVID response. To give you an example of what we were dealing with, we treated around 2,000 patients during the first wave, 500 of them in the ICU. We were constantly having to adapt, always trying to be prepared for what was to come. That meant we were always 2 or 3 days ahead of the crisis in terms of making sure there were enough beds. That strategy did work, adapting it as time went on. We survived that horrendous wave of infections by being as agile as we could.
Historically, the French have been very proud of their healthcare system, often calling it one of the best in the world. Does that now ring hollow?
Throughout this pandemic, healthcare professionals have really gone above and beyond. They've showed amazing solidarity and professionalism over the course of the past 2 years. And we have seen fewer strikes by healthcare workers during this period. Because when you're putting out fires, your patients are your #1 priority. Providing quality care is paramount. Our hospitals rose to the challenge of this crisis in the end. We were able to take in all the patients we were asked to. We looked after COVID patients, but also other patients. But you can't come out of a crisis like that unscathed. At the start of it all, there were people engaged in social action. But after 2 years of fighting the virus, people are tired, they're exhausted. We can see that people are pulling back from careers in healthcare. The professions become less attractive. People are tired, but the system did hold up.
Are you able to be optimistic about the future of public healthcare here in France?
I'm an optimist by nature, so I think things are going to be okay. I think that working in healthcare can make for a great career. It's just that now we need to really invest in people, in individuals. That's really important. I don't think healthcare professionals are only asking for more money. I think they're also demanding that they be given more training. That way they can increase their skills, climb the ladder and get better at their jobs. It's maybe also about making sure we work more in teams, improving workplace well-being, making sure there are projects that bring people together. We hope that we'll soon start to see the sort of thing we witnessed in the wake of the terrorist attacks that hit France. It was horrible to be attacked, but in the aftermath we saw a surge in enthusiasm for the military, the police, the justice system and firefighters. And we're already starting to see a fair amount of young people interested in careers in healthcare.
Professor Andres, thank you very much.
Avec plaisir, merci.
Around 7 million French people live in areas with little access to healthcare services, and that number is only increasing. Villages and towns across France often struggle to find a replacement when their local GP retires. Karina Chabot reports.
This thermal town in the Vosges Mountains has had no dedicated physician for now 2 years. To attract potential candidates, the city has invested massively, turning this hotel into a medical center.
This center can be used by 3 doctors.
Construction work cost 350,000 euros, half of it paid for by the town.
We're looking forward to seeing this place functioning. There's a real need of medical services in this area.
Many are struggling without a doctor within reach. This patient has managed to get an appointment with a physiotherapist.
I can't drive right now, so I need to ask people to take me places. If there's no doctor nearby, it's very annoying for everyone.
There is one doctor some 7 kilometers away from here, but he's so overbooked he cannot take new patients. The city has tried to hire health professionals.
We've spent 11,000 euros on classified ads.
When even that has failed to bring results, the city turned to an international recruiting agency, paying 30,000 euros to try and find a foreign doctor who would accept to settle in town.
The agency used to find doctors exclusively in Eastern Europe. Now it's focusing also on Southern Europe, mainly Greece.
Isolated residents at least have their local drugstore, which provides the medicine.
They give us prescription drugs without a consultation. In a way, that's part of their job.
What's really useful is to be able to get my refill of medication, even when I didn't get a new prescription.
3 years ago, the pharmacy set up a computer so its clients could get video consultations. Every 3 months, 62-year-old Guy Janet has an appointment to monitor his diabetes.
They suggested I get this type of consultation until a doctor comes into town. He was supposed to visit every 3 months, but we've never seen anyone, so I just keep having these video consultations.
Some 30 residents use these video consultations, hoping that someday a doctor would examine them in person.
That brings us to the end of the first episode of our election road trip. For the next stop, we're headed south to the French port city of Marseille to talk all things culture.